Talking with your healthcare team. There will be a lot of new information shared with you when you first find out you have cancer and throughout your care. Some of this information can be hard to understand. It is common to have different emotions about the changes caused by a cancer diagnosis. These feelings can make it hard for you to focus and remember information at times. It is important to talk openly with the members of your healthcare team. They can answer questions about your care and offer needed support. Your healthcare team is here to help you feel your best. Team members may include your primary care doctor or family doctor and an oncologist, a doctor who focuses on cancer care. Based on your care needs, your team may also include a surgeon, radiation oncologist, nurses, nurse practitioners, pharmacists, physician assistants, physical therapists, occupational therapists, social workers, dietitians, patient care resource managers, also called a PCRM, or other types of healthcare professionals. You know your body and how you feel. It is important to share your health history and tell your healthcare team about any changes in your body. This information will help your healthcare team develop the best plan for your care. It is helpful to have your health information organized in a notebook, folder, or electronic file. When you visit a new member of your healthcare team or go to an emergency room or urgent care, take this information with you. Your health information should include a list with the full names, phone numbers, and addresses of your doctors and other healthcare team members. Notes about past and present health problems and illnesses. If you are currently pregnant, planning on becoming pregnant, or breastfeeding. Any past or upcoming surgeries, treatments, dental work, or other procedures, and the date and name of the doctor who provided that service. Medical tests and results, if they are known. Any allergies, such as allergies to medicine, food, or the environment. The type and date of any vaccines you have received. And health information about your parents, grandparents, brothers, or sisters. Your health information should also include a list of all of your medicines. You should write down the name of each medicine and the name of the doctor who ordered it for you. For each medicine, include your reason for taking it, when the medicine was started, how much you take at a time, and how often you take the medicine. List all of your medicines, even if you think they are not important. This list should include prescription medicine, over-the-counter medicine you buy on your own, dietary or herbal supplements, vitamins, creams, inhalers, and eye drops. It is also important to share if you are currently using or have used street drugs. Tell your doctor if any medicine is causing side effects, or if you have any problems taking a medicine as directed. Always check to see if you need prescription refills before you go to a doctor's appointment. Along with your health history and list of medicines, make sure you bring your insurance information, photo identification, such as your driver's license, and any completed advance directive forms such as a living will or durable power of attorney for health care, to each appointment. Bring any medical records that you may have, especially if this is your first appointment with a new doctor. Bring a pad of paper to take notes at each visit. You may want to ask someone to come with you to take these notes. Time can be limited at healthcare visits. Be ready to tell your story. Briefly, tell how you are feeling. Be as specific as possible. Write down your symptoms or problems, including if they are new since the last time you were seen. Explain the symptom, how it feels to you, how often it bothers you, and what makes it feel better or worse. Tell the team if your health problems keep you from doing your regular activities. Share information from recent appointments with medical specialists or changes in medicine or treatment that may have taken place after a trip to an urgent care or emergency room. Make sure to wear your glasses or hearing aids during your healthcare visits. This will help you understand information that is shared. Tell healthcare team members if you need them to speak slower or louder, or if they need to face you when speaking. Your healthcare team may ask you questions such as where you live, who can help care for you if needed, how you prepare meals, if you are able to get to a pharmacy for medicine, and if you have someone to drive you to medical appointments. Share recent life changes, such as a divorce or death of a loved one, and future plans, such as a desire to have a baby. Based on the personal information shared, the healthcare team can work with you to make changes to your plan of care, or work with you to find needed support. Some patients need more time than others need at a visit to answer questions and meet their care needs. If you have a longer wait for an appointment, please know that you will also be given all the time you need during your visit. Asking questions is one of the best ways to take part in your care. Your questions help the doctor and others involved in your care understand what is important to you. They can then share information with you to meet your needs. Organize your questions ahead of time. Write them down and underline or highlight the 3 or 4 questions that you want to make sure are answered. Start with the questions that are most important to you. Your healthcare team wants you to feel your best and to help you understand your cancer diagnosis, tests, treatment, and care. Sometimes these instructions or medical terms are hard to understand. If you do not understand what a member of your healthcare team has said, it is important for you to let them know. It is okay to say, "I don't understand." Try to be as clear as possible about what information or medical term is confusing. Or say, "Can you explain that to me in a different way?" They may be able to use a picture or give an example that can help. Look over any written paperwork or education handouts before you leave the office or hospital to see if you have any questions. It is helpful for you to repeat back any instructions from your healthcare team to make sure you understand them clearly. By using your own words and repeating what you have been told, your healthcare team will know if more instructions are needed. If you have problems reading written material, such as forms or handouts, do not be embarrassed. It is important to tell your healthcare team so they can review any paperwork with you and help you fill out forms if needed. Tell your healthcare team if you do not read, speak, or understand spoken English. They can arrange for someone who speaks your language, called an interpreter, to come in person or talk to you over the telephone or video screen. Let your healthcare team know before your appointment if an interpreter is needed so they can arrange for one to be present. If you are not able to understand written English, steps can also be taken to find written material in your preferred language. In some cases, your healthcare team may suggest a plan for your care that may be different from that of your culture or religion. If this happens, it is important for you to speak up and tell them about your beliefs and cultural needs. Your team will work with you to find a way to meet your healthcare needs while respecting your values. Advance directive forms, such as a living will or healthcare power of attorney, give directions about your medical treatment when you are not able to speak for yourself. If you have not completed these forms, ask your healthcare team for more information. Let your healthcare team know if you have financial problems that may make it hard for you to follow their instructions, such as filling prescriptions, scheduling tests, or making needed follow-up appointments. Your doctor or other team members may be able to make changes to a part of your treatment plan or find resources to help with this need. In some cases, you may be able to talk with your doctor or other healthcare team members at the James through an email set up for our patients. If this is of interest to you, ask your healthcare team for more information about OSU MyChart. Be sure to mark your appointments on a calendar as a reminder. It is helpful if you can schedule your next appointment at the end of each office or clinic visit. Your healthcare team is here to take care of your needs. This includes physical, emotional, social, spiritual, and financial concerns. Let them know what problems you may be having so they can provide suggestions or refer you to resources that may give you needed support. Remember, your healthcare team wants you to know all you can about your cancer and treatment to help you feel your best. Taking an active role in your care will help you to get the right information, support, and care at the right time. We hope this information has helped you to understand the importance of talking openly with members of your healthcare team and to know what information needs to be shared with them. Write down any questions you may have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.